Hello, my name is Kasper Berg and I'm a MD and PhD at the Copenhagen Prostate Cancer Center and Department of Urology at Rigshospitalet, Copenhagen, Denmark. As the first author of the paper, The Impact of the 2005 ESUP Consensus Guidelines on Gleason Grading, a match pair analysis, I would like to thank BJUI for giving us the opportunity to publish our results and for selecting our paper as the best paper in this June issue. The background for the study is the ESUP 2005 consensus report regarding the Gleason scoring system for prostate cancer. Here, an important modification regarding the interpretation of Gleason grade 3 and 4 was introduced. As a consequence, some of the men who previously were categorized as Gleason score 6 are now classified as Gleason score 7, 3 plus 4. To evaluate the impact of the ESUP 2005 consensus guidelines, we conducted a match pair analysis of prostate cancer men undergoing radical prostatectomy. In our institutional database, we identified 215 patients from the pre-ESUP 2005 era with biopsy Gleason score 6 or 7, 3 plus 4. These patients were then randomly matched with 215 patients from the post-ESUP 2005 era. Patients were matched by PSA, clinical tumor stage, biopsy Gleason score, and post-surgical margin status. Patients were followed after surgery and the outcome of interest was biochemical recurrence. For patients with biopsy Gleason score 6, we found that the cumulative incidence of PSA recurrence was significantly higher in the pre-ESUP group compared to the post-ESUP group. The 5 years cumulative incidence of PSA relapse was 29% and 11% respectively. Likewise, for patients with biopsy Gleason score 7, 3 plus 4, the cumulative incidence of PSA recurrence was significantly higher in the pre-ESUP group compared to the post-ESUP group, with 5 years cumulative incidences of 47% and 21% respectively. Interestingly, we found no difference in the cumulative incidence of PSA recurrence between the pre-ESUP Gleason score 6 patients and post-ESUP Gleason score 7, 3 plus 4 patients. This indicates that, at least in terms of biochemical recurrence following radical prostatectomy, contemporary patients with Gleason score 7, 3 plus 4 are comparable to historical Gleason score 6 cases. Finally, we found that the ESUP definition in both univariate and multivariate Cox analysis was a strong prognostic factor for the risk of biochemical recurrence, even after adjusting for other known risk factors. Our results are in concordance with other recent publications in this area. However, we believe that the match pair analysis is a strength of the present study. The changes in the Gleason scoring system has several clinical consequences, as the diagnostic workup and treatment recommendation may shift for a substantial proportion of men diagnosed with prostate cancer, particularly when it comes to choosing between curative intended treatment and active surveillance. And this underlines that the treatment recommendation may need revision reflecting the changes in the Gleason scoring system. Thank you.